Okay, coming back to our patient questions.
Okay.
The first one says, Sir, I was recently diagnosed with chronic kidney disease. I don't understand what that is. Can you please help?
Yes. Again. So in general, what we do is we look at how well the kidney is functioning based on a couple of tests, and the common test that we use is a lab test, and your doctor will always check it. In general, it's the creatinine, and what's called the GFR, and these. So essentially, this creatinine is a substance that's released from our muscles and is cleared by the kidneys, but not completely cleared. So when the creatinine level, the serum creatinine or blood creatinine level starts going up, that can be indicative of some kidney disease. Now, what we do is we take that creatinine number and we plug it into an equation that gives us what's called the filtration rate. And that divides you into the different stages of kidney disease. So typically, the way I say it is, if the GFR is above 90, we're doing pretty reasonable. Very good, excellent. And there are other things that we also look at if we're having any protein in the urine or blood in the urine and stuff like that. Now, if that GFR goes below 60, then we're like, okay, we're starting to get into maybe potential kidney disease. If that GFR goes below 30, then we're going into moderate kidney disease. And if it goes, again, on and on, like under 30, is stage 4 kidney disease where it's severe. And if that percentage, if it goes under 15, that's kidney failure. So you have to look at the creatinine and the GFR to kind of say, okay, where are we in terms of the kidney disease spectrum? And if we have or we're diagnosed with kidney disease, then what are some things that we can do to improve that kidney function? Okay.
What would you say are like the early signs and symptoms of this?
Very, very good question. Give me one quick second. I'm gonna grab my one second. I'm sorry.
That's okay. I think we understand how important coffee is. I don't think I can function without it. And
Oh, thank you so much. No, I just I didn't realize I would talk so much. I just needed water.
that's good. That's good for us. I think we can hear more, understand more. You know what? Take your time.
Okay, so symptoms. Symptoms. Okay, so in general, your body is just amazing, and you may not necessarily have any symptoms of kidney disease because what happens is your kidney compensates for a reduction in their function. So, a lot majority of my patients that I see, they don't have any symptoms whatsoever, but it's actually a diagnosis based on lab tests. So when you're seen by your doctors and they do the test and they see that the kidney percentage is down, the GFR is down, then they'll make the referral to nephrology, and that's where they'll do certain tests to figure out exactly what's going on. Now, let's say remember we talked about the GFR kidney percentage. If that percentage goes below 30, 20, then you start having symptoms of kidney disease. And that can vary, it can be, you can start having some memory issues or a lack of appetite. You don't want to eat anything, or no energy, or can't sleep. You can have itching all over. There's a number of symptoms that can start presenting itself. So the goal is not to get to there. Do whatever we can to keep our kidneys as best.
That's kind of scary, the fact that we can't really tell from any early signs. So, how often would you recommend, regular individuals to just get their GFR, their creatinine checked?
Yeah, so in general, especially after like 30, 35, it's not a bad idea to do like a wellness visit, where we're looking at just basic labs. Again, that's why it's important to kind of follow up with your doctors, do your annual visits, and they always check labs just to make sure cholesterol. It's part of the panel that looks at, not part of the panel, but it's one of the tests that the primary care does to look at organ systems, check the liver, the kidney function, the electrolytes, and all that stuff. So I guess the in summary, or the final thought, bottom line is, make sure you do your routine checks, get your labs checked.
Mm-hmm. Okay, that's good. Thank you.